Hello, it's Dr. Rhonda Johnson, and today is Sunday, June 26, 2022. Today I'm doing an update on monoclonal antibodies. Now, you may have heard of monoclonal antibodies. They are treatments that have been shown to have clinical benefits in the fight against COVID. What they are, they're synthetic copies of human antibodies. They're manufactured by pharmaceutical companies, and they bind to that variant coronavirus to neutralize it and help you fight off infection. Now, data have shown that monoclonal antibodies are very effective in reducing rates of hospitalization and death, and these treatments can save lives. Now, the effectiveness of different monoclonal antibody therapies varies dramatically depending on the circulating variant. The companies do in vitro testing of these antibodies against the circulating variants and subvariants to see if they're effective, because as the virus keeps mutating, the changes in the spike protein often weaken and eliminate altogether the effectiveness of a particular monoclonal antibody. Which brings me to a real important point. This update that I'm providing today is relevant today. In 6 months, this information could be totally out of date, because this is how fluid the COVID situation is as these variants keep changing. So who are they recommended for? They're recommended for non-hospitalized patients with mild to moderate COVID who are at high risk of progressing to severe disease. Now, currently there's only one monoclonal antibody that's effective against the current circulating Omicron subvariants, and so far it's retained activity against BA4, BA5, which are increasing in prevalence. Now, the name of this monoclonal antibody is bebtelovimab. I'm just going to refer to it as BEB, B-E-B, for the rest of this video, because bebtelovimab is kind of hard to say. Now, it's given by IV injection. It's for patients who weigh more than 80 pounds and who are at least 12 years of age. Now, it's indicated primarily when Paxlovid and remdesivir are either not available, feasible to use, or clinically appropriate. And treatment should be initiated as soon as possible after a positive test and within 7 days of symptom onset. Again, folks, if you need oxygen or require hospitalization, BEB, B-E-B, the monoclonal antibody that I'm talking about, it's not going to be given to you. You'll get other treatment. So some of the high-risk conditions for this treatment, per the manufacturer's website, Eli Lilly, include an older age person, someone with obesity, diabetes, chronic kidney disease, cardiovascular disease, high blood pressure, immunosuppressive conditions, and, folks, pregnancy. But that list is just what's on the website. This is where your doctor comes in and can advocate for you and determine if you're a candidate for this monoclonal antibody. Now, a lot of people don't know about these monoclonal antibodies. And folks, COVID is still killing an average of 355 people a day here in the United States. Now, the CDC published a paper in their Morbidity and Mortality Weekly report in January, which identified racial disparities in monoclonal antibody treatment, with white patients being more likely to get this treatment than Black, Hispanic, Asian, or other racial groups. So, folks, it is very important to know the symptoms of COVID, get it tested, talk to your doctor, see if you can get monoclonal antibodies if you're eligible. Your doctor may not offer it to you. You may have to ask for it. And if you're not a candidate for monoclonals, maybe you'll be a candidate for Paxlovid. That's my message today. Take care and be safe, folks.